Hello everyone, my name is Majid Saeed Abbasi and my presentation topic is antihyperlipidemic drugs. First of all, I will define what are antihyperlipidemic drugs. These are the agents reduce blood level of lipids, cholesterol or triglycerides, thereby reducing completion of atherosclerosis. This is a definition of antihyperlipidemic drugs, and now what are classification of these drugs. These drugs are classified into 10 major groups. First is cholestyramine, second cholestyramine, third niacin, four clofibrate, five gemfibrozil, six propofol, seven doxycytosine, 8 neomycin, 9 HMG-CoA reductase inhibitor, and last is lovastatin. These are 10 major groups of antihyperlipidemic drugs. And now you can see in the table the next topics are cholesterol, triglyceride and phospholipids. In antihyperlipidemic drugs, these are abnormally fat portion known as lipid restrict blood flow that increase heart attack or stroke. These are three major lipids. First is cholesterol. Cholesterol is nexus for the synthesis of bioacids and steroid hormones and maintain membrane of cell. Okay, next is triglyceride. Triglycerides composed of three fatty acids, source of energy stored in body. And last or third is phospholipids. Phospholipids are major components of cell membrane. These lipids are in plasma blood, transport in body in a shape of capsule known as lipoprotein. Okay, these are 80% and 20% you can see in the table. You can also see the animal cell in the table organelles, and the places of these cholesterol triglycerides are phospholipids. Okay, the next we have a topic of lipoprotein. What is lipoprotein? Lipoprotein consists of hydrophobic core made of cholesterol and triglycerides surrounded by the hydrophobic shell made of phospholipid and apolipoprotein that are specialized protein that control enzymes and lipoprotein metabolism. This protein divided into four chambers due to density. Okay, first is chylomicrons and its density is 0.95. Next, very low density lipoprotein VLDL, density is 0.95 to 1.006. Third is LDL or low density lipoproteins, and its density is 1.019 to 1.063. Fourth is high density lipoprotein or HDL, and its density is 1.063 to 1.210. Okay, and its primary components are dietary triglycerides 90% and cholesterol. You can see in the table diameter is 75 to 1200 micrometer. VLDL is endogenous triglycerides and cholesterol, diameter is 30 to 80 micrometer. LDL primary components is cholesterol, diameter is 18 to 25 micrometer. HLDL primary components are phospholipids and proteins, and diameter is 5 to 12 micrometer. Okay, next table comes us to the result of analysis. And what is these results? These results is analysis of these VLDL, HDL and LDL. And I will talk about the chylomicrons, VLDL, LDL and HDL. What are these? First is chylomicrons that are producing in dietary lipids and composition small amount of cholesterol. Okay, next is VLDL that produces liver composed of primary triglycerides and some cholesterol that are amounts in large. Then chylomicrons. Now function of these two lipoproteins of to deliver energy to triglycerides towards cells of body. Okay, I will tell about the VLDL or chylomicrons. Chylomicrons have small amount of cholesterol, and VLDL is have high amount of cholesterol. And the next is LDL. What are LDL means? low density lipoprotein. LDL mostly taken by the liver, used in synthesis of bioacids necessary for the digestion absorption of fat soluble in small intestine. Excessive cholesterol lipoprotein bounds to liver by HDL. Okay, I will tell about this, and some more details are of these are now. Problem axis in arguments of steps of these lipoprotein high level of cholesterol that accumulates in innermost artery value lead to atherosclerosis that LDL often bad cholesterol. This HDL prevent atherosclerosis lessen by removing cholesterol. And what they cause? That cause oxidation, vascular inflammation. HDL is good cholesterol. Okay, now several classes of major lipid lowering drugs. Okay, these are the table of result of analysis. You can see in the table what are these. Description is cholesterol total result 3.8, HDL cholesterol 0.85, LDL cholesterol 2.6, triglyceride 1.87, and atherogenic index is 3.47. Okay, you can see the units and norms of these, and you can also see the structures of these body organs and the location and the LDL percentage, kilometrons, and whole of these situation. Next is types of antihyperlipidemic drugs. There are 6 types. First is HMG CoA recruitase inhibitor known as statins. Second is miscellaneous antihyperlipidemic drugs. Third is fibric acid derivatives or fibrates. 4 is bile acid sequentrants. 5 is cholesterol absorption inhibitors. 6 is proteins convertase subtylysins or caxin type 9 inhibitors known as PCSK9. Okay, and I will tell about whole 6 of these types, and now the details of these types are. First is statins. What are statins? Statins affect with concentration of cholesterol within liver cells which produce cholesterol production begin to compensate more LDL receptors which interbind LDL in blood circulation. Addition, low intracellular cholesterol level lead to secretion of VLDL. Okay, you can see in the table also. And now now the next of types of statins is. First is atorvastatin lipator. Internal dose is 10, 20, 40 and 80 mg. Half life is 14 hours. Second is lovastatin ultrapro. Internal dose is 20 or 40 mg and half life is 2 to 5 hours. And third is paravastatin paravacol. Internal dose is 20, 40 and 60 mg. half life is 1.8 hours. 4 is simvastatin zacor. Internal dose is 5, 10, 40, 80 mg and half life is 2 hours. And now I will tell about the side effects of these. These atorvastatin metabolized in liver may elevate liver enzymes and increase liver toxicity in insatiable patients. Use of statin secondly has been associated with the muscle related problems. Yes, you can face the muscles related problems and headache, dizziness, feelings usually tired and physically weak, digestive system problems such as constipation, diarrhea, indigestion or fatigue, muscle pain and low blood platelet count. These are side effects of these medicines like statins. And now the second is niacin or miscellaneous antihyperlipidemic drug. Okay, what are niacins? So unlike statins, niacins works in adipose tissues, inhibits hormone sensitive lipase responsible breakdown of triglyceride in free fatty acids. Normally liver uses these fatty acids to make triglycerides important composition for VLDL for reducing VLDL. So by reducing free acids available for transport to liver, niacin effectively. Okay, and now decrease VLDL synthesis which turn to decrease level of LDL. Niacin increase in HDL is different mechanisms. Okay, I will tell about these. And now What are side effects of these niacins? Okay, high doses of niacins available via presentation can cause or side effects. Serve skin flushing combined with dizziness, rapid heartburn, itching, nausea and vomiting, abdominal pain, diarrhea, gout, liver damage is one of the flushing caused by niacin prostagland in release, which result to vein dilations. Niacin complete with uric acid excretion by kidney, hypernausea and gout. Lastly, niacin cause liver toxicity. These are also the side effect of these niacin. Okay. And name and internal dose is first is generic name niacin, brand name Niaspam. Internal dose is 500 mg and half life is 20 to 45 minutes only. And you can see also the table of this proliferated activated receptor alpha. Okay, LPL lipoprotein lipase is also in this, and the third is fibric acid derivatives or fibrates. What are fibrates? Fibrates primarily activate nuclear transcriptions called receptor proteosomes PPAR alpha. I was tell about firstly metabolically act on liver adipose tissues by bind of fibrate to PPAR alpha activation and inhibition of certain genes play a role in lipid metabolism. One of them fibrate increase lipoprotein. Yes. And next is lipase, which turn to increase fatty acids. Furthermore, fibrate sequence which inhibit lipoprotein actively, fibrate also increase. Okay. And now what are the side effects of these are indigestion, heartburn, stomach, abdominal pain, arterial fibrillation, diarrhea, fatigue, nausea, vomiting and eczema is also included in this. Yes, you can see. And the name of these are fibric acid derivative or fibrates, gymofibrosil lipo internal dose is 600 mg tablet, half life is 20 hours. And fenofibrate tricor internal dose is 160 mg tablet, half life is 20 hours. Now, and the side effects I will tell about firstly. And now is constipation, stomach, abdominal pain, gas, nausea and vomiting also includes in this. And lastly, because fiber increase in cholesterol is bile, risk of gallstone inflammation also includes in these side effects. And the fourth is bile acid sequestrants. What are bile acid sequestrants? Bile acid produced in liver, stored in gallbladder, excreted to digestion of lipids, bile acid salts and negatively charged salts in small intestine. The insoluble complex liver cells increase LDL cholesterol and level is decrease LDL circulating. Example of drugs related are cholesterol, cholestyramine. Side effects are named constipation. Yes. What are the side effects of these are diarrhea, back pain, stomach or abdominal pain, nausea or tiny feelings, tired feelings, headache, dizziness, depressed. You can also see, and I will tell about the what are cholesterol absorption inhibitor. Free cholesterol is intestine bile density source bind with NPC1L1 located plasma membrane intestine walls. I was also tell about its location. These bind are endocrine, clathrine, AP2 also. And what is next is cholesterol absorption inhibitor. I will tell about also these. I will tell. And the name of generic name is azitimib. Brand name is Zitia. Internal dose is 10 mg and half life is around 22 hours. You can also see the structures of LDL VDL, what they works. And next is PCSK9. What are PCSK9? PCSK9 enzymes circulating drug bind LDL surface of liver cells and promote proliferation actively of PCSK9 to remove LDL circulation. Yes, you can understand now. PCSK9 Also, antibodies bind with inactive PCR. These are more absent LDL present for the circulating, leaving increased level of cholesterol. You can also see in this internal dose, and what are these are name, and PCSK. I was also tells the detail what are they, and now what are PCSK inhibitors. First name is alirocumab prevalent, and is in the parenteral doses is 75 and 150 mg per milliliter, and half life is 17 to 20 days. And next is evolocumab, and his parental doses is 140 mg per milliliter, 420 mg per 3.5 milliliter. Half life is 11 to 17 days. Thank you for your attention, and these are the antihyperlipidemic drugs. These are my presentation. Allah Hafiz. Thank you very much.